2-year outcomes with a magnetically levitated cardiac pump in heart failure. Personal data. Name, Jorge Daniel Silver Garcia. Email, aaron.dani@hotmail.com. Facebook, Jorge Daniel. Twitter, @dasnueto. Teacher, Moscow Escobar John Fernando. Definition. Is a cutting-edge technology to produce artificial hearts and higher performance blood pumps.
Do you know the symptoms of heart failure? During heart failure, the heart can't pump blood efficiently enough to meet the body's needs because either its pumping ability has weakened or because the lower left chamber has become thick and no longer holds enough blood. Without proper pumping, fluid can build up and cause symptoms that everyone should learn to recognize. Swelling, also known as edema, is most often noticed in the feet, ankles, legs, or abdomen. Sudden weight gain. People with heart failure can also track their weight to help manage any swelling. Shortness of breath is another important symptom to discuss with your doctor.
Application in medicine. Implantable rotary pumps have been developed and used to assist the impaired heart ventricle because of lack of heart donors for transplant. Pro. Cons. Reoperation for pump malfunction was less frequent in the centrifugal flow pump group than in the axial flow pump group.
HeartMate 2 is a small and quiet advanced blood pump designed for improved outcomes with a wide range of late-stage heart failure patients in need of reliable, long-term circulatory support. 60% smaller than currently approved implanted electric pulsatile LVADs and weighing only 400 grams, the HeartMate 2 incorporates precision engineering, a simple design, and 30 years of clinical experience. It is intended for long-term support or for permanent implant, known as destination therapy. The external system components of the HeartMate 2 include a small, flexible percutaneous cable that provides power to the pump and is designed to accommodate patient activity, the system controller, which controls pump operation, and the batteries, which may be conveniently worn in holsters and enable the patient to resume normal daily activities.
Issue applied in Ecuador. In an early analysis of this trial, use of a magnetically levitated centrifugal continuous flow circulatory pump was found to improve clinical outcomes as compared with a mechanical bearing axial continuous flow pump at 6 months in patients with advanced heart failure.
An estimated 150,000 Americans have advanced heart failure, and when standard medical therapy is no longer effective and a near-term heart transplant is not available, Implantable heart pumps often are the only other option for patients. Leonora Childers had just given birth to twins, Ava and Julian, when she developed heart failure. The damage to her heart was so extensive that doctors felt that implanting a new continuous flow pump represented the best chance for a positive outcome.
I had never heard of a heart pump until I was implanted with one. I did not even know that was an option. Certainly it saved my life.
Although heart pumps have been around for years, the new continuous flow pump, called the HeartMate 2, is about 1/7 the size of the more commonly used pulsatile flow pump. The smaller size of the continuous flow pump allows patients like Leonore to get around more easily. In Leonore's case, spending quality time outside with her kids. Now,
Conclusion. In patients with advanced heart failure, a fully magnetically levitated centrifugal flow pump was superior to a mechanical bearing axial flow pump with regard to survival, free of disabling stroke of operation to replace or remove a malfunction device.
The heart has 4 muscular pumping chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. The left ventricle pumps blood out through a large artery called the aorta to supply the body with the oxygen and nutrients it needs. In left-sided heart failure, the left ventricle is not able to pump enough blood to the body. The 2 types of left-handed heart failure are diastolic, where the left ventricle can't relax enough to fill with blood, and more commonly, systolic, where the left ventricle can't contract strongly enough to push blood to the body. In severe or end-stage heart failure, the heart is getting weaker and doesn't respond to medication. For left-sided end-stage systolic heart failure, a doctor may recommend an implantable left ventricular assist device, or LVAD, to help the heart pump enough blood to the body. An LVAD is a small mechanical pump implanted inside the chest or abdomen that takes over the job of the weak left ventricle. Blood flows from the left ventricle through an inflow tube to the pump. The pump pushes the blood through an outflow tube into the aorta. From here, the blood travels normally from the aorta to the rest of the body. A cable, called a drive line, connects the LVAD pump inside the chest to a control unit located on the outside of the body. The control unit is a small computer that controls the functions of the pump and alerts the patient if there are any problems. The pump and control unit receive power through a cord connected to a battery pack. Finally, the heart has 4 muscular pumping chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. The left ventricle pumps blood out through a large artery called the aorta to supply the